get the recording. Thank you for joining us today. My name is Becky Sanders, and I'm the Program Director for the Upper Midwest Telehealth Resource Center. Today, in this virtual office hours, we are going to do a quick overview of the 2022 CMS physician fee schedule and walk through some information on that. There is still time to provide comments on the proposed fee schedule until September 13th. That's the deadline. So let me go ahead and share my screen. All right. So Carolyn Miller is also on the call from the Upper Midwest Telehealth Resource Center. And if you have any questions during the presentation portion of today's event, you can chat them. I will take a look at them when I'm done, and then we'll hopefully have some good discussion at the end of the presentation today. So without further ado, I can't do any presentation without thinking about or talking about the National Consortium of Telehealth Resource Centers. There are actually 12 regional telehealth resource centers where we cover the lilac states of Illinois, Indiana, Michigan, and Ohio. And then the other 11 regional telehealth resource centers are indicated in different colors around the map. There are also 2 national centers. TTAC is the National Technology Center, and CCHP is the Center for Connected Health Policy, and that they are a policy center. You can get to any of the 14 of us through this telehealthresourcecenter.org website, and there's also monthly webinars available that you can sign up for there as well. Here at the UMTRC, we consider ourselves virtual librarians, especially with what we've been through in the last 15 months or so with the global pandemic. But we do a lot of individual consultations and technical assistance. We connect people with other programs, help with project assessments, and provide updates like today on policy and legislative developments. On an ongoing basis, we have our own webinar series. We try and do 1 to 2 webinars a month. We have our podcast, A Virtual View. We have virtual office hours like this twice a month. And we have telehealth workshops, and we are in the finishing stages of doing our demo video recordings for our training and demo center. Just wanted to stick this slide in, just a little bit of the history of telehealth and telemedicine. You may not have been aware of telehealth until recently with the global pandemic, but you could argue that telehealth started way back in 500 BC when they used smoke signals to communicate from one community to another. I try to use mostly the term telehealth, but the term telemedicine is really talks about that clinical billable service between a patient and a provider when they're at a distance from each other. Excuse me. Pardon me. You may have heard also different terms like e-health, m-health, video visit, and virtual care. And the terminology is really changing in this field as more and more individuals and more organizations start to participate in virtual visits. So when I talk about telehealth or telemedicine adoption, I like to talk about the UMTRC being this little rowboat in the middle of Lake Michigan. And that's how I felt about 10 years ago when I took over this position. Then we had the global pandemic, and now it's like we're driving this big, huge cruise ship, and there's not enough berths for everyone that wants to participate in virtual care. So back from a billing and coding perspective, back at the beginning of 2020, when the COVID pandemic first hit the United States, CMS added about 80 new CPT codes to the list of codes that Medicare would pay for telehealth visits and encounters. There was a lot of pushback that there weren't any codes that could be used just for a phone conversation, and many residents didn't have adequate broadband access or devices for video visits, so they were only able to participate in audio visits. So CMS did allow for the billing of telehealth and telemedicine using these codes 99441 through 99443. Other things that happened in that March and April timeframe last year was the elimination of geographic barriers so that patients did not have to be in a rural area at a clinical originating site, but they could be seen from their own homes. And certain several disciplines had expanded roles, and they were able to provide services via telehealth for the very first time. Included in those are occupational therapy, physical therapy, and speech language pathology. There were many other waivers, including the change that skilled nursing facility telehealth visits, instead of being once every 30 days, are now once every 14 days. A lot of waivers for supervision and those types of things. It was a very, very busy time for the telehealth resource centers. And one of the things that came out of the final interim rule that was released last March was the relaxation of the HIPAA rules around the telehealth platform that was used for telehealth services. And I like to compare and contrast all 4 states. Each state in the Upper Midwest Telehealth Resource Center region worded their waiver a little bit differently in their Medicaid proceedings, but I like to show you these just as an example. And many organizations hadn't really dipped their toe into telehealth prior to the pandemic, so they didn't have a standard platform to fall back on. Many times they use things like FaceTime or Facebook Messenger video chat or Google Hangouts. And those are great platforms, but they're not HIPAA compliant. We, especially now that we're 15 months into this pandemic, we certainly hope you have done your due diligence and looked at different platforms that are available to you. Certainly, if you have questions, you can contact us, and we'll talk to you individually about different platforms. So we do recommend a HIPAA compliant technology. We do believe that once the pandemic has sunset, we will see those HIPAA rules go back into full force. So last year, at the end of 2020, CMS, the finalized physician fee schedule for 2021 came out in December, and our policy center, CCHP, put together this fact sheet. And it's out there on their website. Here's the URL if you want to go ahead and take a look at it. But it really breaks things down into a very clear and concise information. So it's very helpful to look at. As we start looking at the changes that were made for 2021's physician fee schedule, I don't want to spend a lot of time on this, but this is kind of a snapshot of where we're at now. CMS took about 60 of those 80 codes that they'd added during the pandemic, or at the beginning of the pandemic, I should say, and added them, some of them, to that permanent Medicare Category 1 telehealth list. And then other codes, they said, well, we're only going to have these codes as Category 3 telehealth codes, and they're only going to be reimbursable through the end of the calendar year that the PHE, or the public health emergency, concludes. So it's still yet to be seen when that federal PHE will expire, but there's changes that came out in the proposed fee schedule for 2022 that talk specifically about these codes. We'll get to those in just a minute. So there is a new audio-only code after the public health emergency. And even now, CMS is encouraging you to use HCPCS code G2252 instead of those audio-only codes 99441, 2, or 3. So just recently, the CMS 2022 proposed physician fee schedule came out. Here are some of the biggest things about it. There's a lot of information in it, a lot to unpack. They reiterated that this process of proposed fee schedules has been going on since 1992, and every year in the July timeframe, CMS issues this proposed rule, and then there's a comment period, which ends in September, and then usually in December, they will release the final rule for the following calendar year. So some of the biggest things, I mentioned that list of codes that previously in the 2021 physician fee schedule were only going to be available until the end of the calendar year during which the PHE sunset. So in this new 2022 proposed fee schedule, they're already saying that those temporary codes, those category 3 codes, will remain in effect until December 31st of 2023. So they've been around since 2021, and they're going to go through 2022 and 2023. So that's 3 years, 12 months, 36 months that they will have data to analyze about those codes to see whether it's worth keeping them or letting them sunset. One of the biggest things that is in contention right now, this new proposed physician fee schedule does allow for home as an originating site, but it also requires an in-person visit within every 6 months prior to the initial telehealth service, and at least once every 6 months thereafter. So there's a lot of discussion about this in the industry, and we'll just have to wait and see. Certainly if your organization feels strongly about that issue, I encourage you to go ahead and submit comments. Also, CMS is looking for comments on audio only for mental health services, and whenever the beneficiary is not, or that would be the patient, is not capable of using a two-way audio video service. So I took some screen grabs. Again, CCHP is our National Policy Center, put out a very compact, easy to digest version of a fact sheet about this. And I took just a couple of the tables out of that, and here's the link to their fact sheet. But this also helps to see, what different proposals are included in this proposed physician fee schedule, and whether or not they're talking about in-person visits within 6 months. So you can see here the Consolidated Appropriations Act, which I think it was finalized in December of 2020, did incorporate this language about an in-person within 6 months. That it had to be an established patient that had been seen first in person, but then the patient could be at home, and the provider could provide services to the patient at home. There's also this audio only portion of the proposal. Again, they're talking about established patients that have been seen within the last 6 months, then they can be at home, and they may or may not be able to do live video. And then there's this portion of it, the proposed fee schedule, that talks about federally qualified health centers, or FQHCs, and they're seeking comments on that and whether or not patients can connect via audio only for those services. Another table that CCHP put in their fact sheet is this one, and I liked the way it listed the different elements here, the different ways that a patient could be seen. So we have this geographic limit, and we're seeing proposals for no geographic limits for or limitations for FQHCs and RHCs. It was included in the Consolidated Appropriations Act. We're also seeing those barriers and restrictions removed for treatment of SUDs or substance use disorders with mental health conditions. And here, home as an originating site, we see that being a possibility, and home is eligible as the originating site here, and visits may take place in the home for FQHCs and RHCs. And then here, the audio only for mental health services. You can see that this, again, they're talking about established patients only, but the patient could be at home. The provider could do live video, and what would happen in different scenarios around that. And then lastly, I'm talking about that in-person visit prior to telehealth services. Under the original telehealth policy, it would not be an option unless audio only is used. Under the Consolidated Appropriations Act, it would require an in-person visit within 6 months. And for FQHCs and RHCs, they're exploring that possibility. And I will say, when you talk about in-person visits prior to telehealth services, that all of the 4 states in our region have made permanent legislation or guidance in their Medicaid rules about allowing the establishment of that provider-patient relationship via telehealth on their very first visit. So it would be nice if Medicare would do something similar. So it still remains to be seen. Oops, got ahead of myself there. All right. So we've been talking about the public health emergency, and historically, throughout time, as a public health emergency is released or stated by the federal government, it is done through Health and Human Services, and it lasts for 90 days. Under the previous administration, they had done that as well, and they had released every 90 days a new public health emergency at the federal level. When the Biden administration took over in March, they confirmed their new cabinet member, Javier Becerra, confirmed as the Secretary of Health and Human Services. And within a month of him being confirmed into office, he did extend the public health emergency until July of 2021. And then right before that one was set to expire, then he did extend it until October of 2021. So again, we don't know for sure if the public health emergency will go into 2022 or not. With the increase in the Delta variant, it's certainly possible that will be extended again into 2022. The Medicare Learning Network Telehealth Fact Sheet is our gold standard about which codes can be used to bill for services for Medicare telehealth reimbursement. This is a big game changer. It is very different from previous fact sheets. It was just released recently. I found it this morning when I was double checking my slides for today. This one is 6 pages long. The previous one for calendar year 2020 had been 13 pages long. The biggest change is they took out the grid of actual codes, and there's a hyperlink to the codes. So, oops, my mouse is very sensitive today. Hang on. All right. So normally you on this page, you would see a grid with the list of codes and services attached to them, but now you have to click this hyperlink to get those individual codes. But what this fact sheet does is it really covers everything you need to know about billing and payment for Medicare telehealth reimbursement. So it talks about the HCPCS codes and the modifiers to be used, and 02 for place of service, these types of things, and how you bill to your Medicaid administrative contractor. Also in this, I wanted to point out the content of this. This is actually on page 1 of the new fact sheet that is talking about here. This fact sheet does not include or reflect the waivers and flexibilities that are in place right now during COVID-19. And it sends you to a specific link for up-to-date information on the blanket waivers for COVID-19. All right, we talked a little bit about prescribing of controlled substances. And this is pertinent to when a when a provider and a patient can establish their relationship and establish that physician-provider relationship over video conferencing utilities so that they can prescribe on that very first visit. This is often done in behavioral health cases where they want to initiate buprenorphine. All right, so also I wanted to mention that the CCHP, the Center for Connected Health Policy, has changed the way that they do their 50-state report. Each spring and fall, they used to do a comparison of all the 50 states and what the Medicaid guidance was in each state. They have, because there's been so many changes over the past year and a half, they have changed that so it's being updated on their website on a regular basis. They are still going to be doing a 6-month report, but it will have more of just the executive summary that can be downloaded. So I often get asked, what's the future of telehealth and telemedicine? And especially with what we've seen in the proposed physician fee schedule for 2022, I really think the future is bright. I wish I had a crystal ball, but there's a lot of continuation of different waivers that have come to pass during the pandemic and the extension of those Category 3 telehealth codes until the end of 2023. So I really think telehealth is here to stay. And I think we'll see it incorporated more and more into the way that we receive healthcare. If you are just finding us for the first time, you can sign up for our newsletter on our website. You will get these slides. There's the link to that. There's many ways that you can connect with us through our website, through our podcast. We have a YouTube page, a Facebook page, a Twitter page, and a LinkedIn page. And there's a contact information for Carolyn and I. I am going to stop sharing my screen and open things up for questions. So we will be sharing our slides and posting the recording from today on our archived webinars page. So that will be available in the next couple of days. What other questions do we have? All right, Carolyn, would you go ahead and put the survey into the chat for us? So please click on the survey link. We are federally funded and our funders often ask us for feedback on the different services that we provide. So we'd love to have your feedback. If you have suggestions or questions about future events, please let us know. Last chance for questions. All right, well, if there's nothing else, I'll give you guys back about 5 minutes in your day. Have a great day and thanks for joining us.